Hello guys, welcome to MAURYA Medical Education. Today we discuss malaria disease. So first, introduction. Malaria is one of the world's most severe public health challenges, predominantly affecting tropical and subtropical regions such as sub-Saharan Africa, South Asia, and parts of South America. While it is a serious and potentially fatal disease, it is both preventable and curable. Definition: malaria is a life-threatening acute febrile illness caused by Plasmodium parasites, which are transmitted to people through the bites of female Anopheles mosquitoes. It is not a virus or bacteria, it is a parasitic infection that primarily attacks the red blood cells. The incubation period of malaria is typically 7 to 30 days. Here is the quick breakdown by parasite type. P. falciparum, 9 to 14 days, shortest, most dangerous. P. vivax and P. ovale, 12 to 18 days, can sleep in the liver and appear months later. P. malariae, 18 to 40 days, longest typical period. 1. The primary cause, the parasite. Malaria is caused by a single-celled parasite called Plasmodium. There are 5 types that infect humans, but P. falciparum and P. vivax are the most common and dangerous. Rare ways of transmission. Since the parasite lives in red blood cells, malaria can also, rarely, be spread through blood transfusions, organ transplants, sharing needles or syringes, from mother to unborn child, congenital malaria. Common symptoms: what you feel. High fever and chills, violent shivering, feeling freezing, followed by burning heat, severe headache, often throbbing, profuse sweating, usually happens when the fever breaks, body aches, pain in muscles, joints, and back, nausea and vomiting, upset stomach, fatigue, feeling weak or exhausted. Visible signs, what can be seen: high temperature, often above 38 degrees Celsius or 100.4 degrees Fahrenheit, pallor, pale skin or pale inner eyelids due to anemia, jaundice, yellowing of the eyes or skin, dark urine, tea or cola-colored urine, a sign of severe infection. The classic malaria cycle. Symptoms often come in a 3-stage attack that lasts 6 to 10 hours. Cold stage, shivering and shaking. Hot stage, high fever, headache, vomiting. Sweating stage, sweating, fever drops, tiredness. Pathophysiology, the malaria life cycle. 1. The vector, Anopheles mosquito. The cycle begins with the Anopheles mosquito, the vector that transmits the malaria parasite. Only female mosquitoes bite, as they need the protein in blood to develop their eggs. 2. Transmission to human. When an infected mosquito bites a person, it injects saliva containing Plasmodium sporozoites into the bloodstream. These sporozoites are the infective form of the parasite. 3. The liver stage, exoerythrocytic cycle. The sporozoites travel to the liver and infect liver cells, hepatocytes. Inside these cells, they multiply asexually, forming thousands of merozoites. The infected liver cells eventually burst, releasing the merozoites to infect new red blood cells. This cyclical bursting of red blood cells and release of toxic waste products causes the characteristic fever and chills of malaria. The gold standard, blood smear, microscopy. This is the most accurate test used by hospitals. A drop of blood is placed on a glass slide and examined under a microscope. Thick smear tells the doctor if you have malaria, detects the parasite. Thin smear tells the doctor which type of malaria you have, identifies the species, example P. falciparum or P. vivax. The quick test, rapid diagnostic test. This works like a home pregnancy test, but uses a drop of blood from a finger prick. Time gives results in 15 to 20 minutes. How it works: detects specific proteins, antigens produced by the parasite. Use: very common in clinics or rural areas where microscopes aren't available. Advanced test: PCR, polymerase chain reaction. What it is: a high-tech lab test that detects the parasite's DNA. Use: it is very sensitive and can find hidden malaria when other tests are negative, but it takes longer, often 24 hours, to get results. Malaria is treated with prescription drugs to kill the parasite. The types of drugs and the length of treatment will vary, depending on which type of malaria parasite you have, the severity of your symptoms, your age, and whether you're pregnant. Medications. The most common anti-malarial drugs include chloroquine phosphate. Chloroquine is the preferred treatment for any parasite that is sensitive to the drug, but in many parts of the world, the parasites are resistant to chloroquine, and the drug is no longer an effective treatment. Artemisinin-based combination therapies, ACTs, is a combination of 2 or more drugs that work against the malaria parasite in different ways. This is usually the preferred treatment for chloroquine-resistant malaria. Examples include artemether lumefantrine, Coartem, and artenisate mefloquine. Other common antimalarial drugs include atovaquone proguanil, Malarone, quinine sulfate, Qualiquin, with doxycycline, Oracea, Vibramex, others, primaquine phosphate. Thanks for watching. Please